So many of you have heard on the news this idea of bending the cost curve in healthcare. The green line is where our costs should be. Our blue line is where our costs actually are. The delta this year was about $1 billion. This is money that was saved by collaborative work. This is, by the way, money that would have been extra revenue for us if we hadn't taken the cost out. But the way we look at it is, this is $1 billion that the communities don't have to spend on healthcare. And this is really, to a large extent, what Intermountain's all about. Be a model system, provide extraordinary care, make it accessible, and keep it cost effective. One of the major drivers in keeping costs down is our supply chain. Has saved about 2/3 of $1 billion in the last 10 years. And we're very proud of them. They were recognized as the #1 rated supply chain in the United States in 2016. One of the goals of having engaged caregivers is for them to tell us what's broken and how we can fix it. Last year, we had almost 900 continuous improvement projects at Intermountain that were driven by our own caregivers. It improved their engagement. It also helped us with some of this cost control so that care could be more affordable to our patients. And they saved us, our caregivers saved us almost $8 million based on their smarts about what really needs to happen. We know that in a high deductible environment, people are very price sensitive, as they should be. And particularly for the millennials, they're very thoughtful about how and when they want to be seen. We've begun to develop a robust telehealth presence. Connect Care has provided about 4,500 visits up through the end of 2016. It's growing month by month. And you can see how a telehealth visit is about 1/10 of the cost of an emergency department visit. So we work hard to get people into the right level of care so they don't bear undue burden, and nor does the system. So if you look at commercial insurance and you rank the 350 biggest cities in the United States, we have 3 cities in Utah that are amongst the lowest cost, the lowest 10 cost per capita of any cities in the United States. We don't think that's an accident. If you say to yourself, well, that's just commercial insurance. Those are young, healthy people. If you look at Medicare data, what you can see here is that Intermountain sits at the high quality, low cost sweet spot of exactly where one would hope that their state would sit. We are very fortunate to have great financial stability. So if you look at our bond ratings, which is sort of like, the credit card score for a health system, we have the highest bond ratings of any health system in the for-profit or not-for-profit world. So why should we be excited about that? Well, what it means is that we can access money that we can put back into the community and pass those low costs on to the people who are our patients with great facility. This strength is only important based on what we can do for other human beings. We do know that regardless of what the strategies are from a legislative standpoint, the reality is that what we've been doing for decades around providing high quality at the most affordable cost, it's always the right strategy for the people. And we're going to stick with that regardless of what else happens.